Hi, everyone. Good afternoon. Dr. Abhay, thank you once again for your valuable time. I know how busy you are, but thank you for making time to talk about endometriosis today. This is a condition that plagues millions of young women across the world. And if not handled at the right time, besides creating issues with the period cycle, it is more dangerous when they become endometrial cancers. And of course, addressing the root cause, which is a hormonal imbalance, is prime importance. There are, of course, the allopathic ways, which we're not against, but that is only symptomatic in approach. And finally, the lifestyle has to be changed to address the root cause, because obviously the endometrial lining is being fed by the excess of estrogen and imbalance and causing problems, including rendering a lot of women unable to conceive. So thank you so much for your time, Dr. Abhay. In short, can you explain to all our viewers in your practice, what you see in endometriosis, what exactly is happening in a woman's body? And, from a homeopathic angle, how does homeopathy, differ from allopathy, and what benefits can it bring in the treatment of endometriosis?
Yes, so good afternoon, and thank you, Luke, for having me on this talk. And I'm happy that I can share my thoughts with all our viewers. So before we go ahead, we need to actually try and understand what exactly endometriosis is and what is the difference between endometriosis and adenomyosis, because these are two common conditions which are seen very often these days. And as you rightly said, there are a lot of young women who are coming with these conditions, and the biggest problem that we are having is that it impacts their fertility. So on an average, we see that around 50% of women who are trying to get pregnant and having some difficulty, who come to us for treatment, they are having endometriosis. So this is something which really impacts their fertility a lot. And the scientific community has various kind of theories about endometriosis and why does it happen to begin with. So there are various theories where they say that it could be congenital, that they say that it could be because of some previous surgical interventions on the uterus. Some of the theories say that it's because of very painful menstruation. But essentially, what happens in endometriosis is that the endometrial lining, which is supposed to be the inner lining of the uterus, which gets shed during the menstrual period, this somehow travels and gets implanted at different sites. So you can have implants at near the rectum, you can have implants of this endometrial tissue near the bladder and various other places inside the abdominal cavity. Now, what happens is that whenever during the monthly cycle, these tissues will respond in the same manner to the changing hormonal levels that a woman goes through during her entire periods. So essentially, uh, it starts bleeding, and this bleeding does not find any outlet. So this blood and this whatever material gets trapped in between tissues and causes inflammation, causes infection, and so on. So we have a lot of women coming to us with severe pain in abdomen. They can have very heavy periods, they can have painful sex, all these kind of complaints they do come with. And eventually when we try and investigate them, we find that they have either got endometriosis or in some cases adenomyosis. Now adenomyosis and endometriosis, though it can express in similar forms, like I said, that the tissue responds to the monthly hormonal changes. Essentially, in adenomyosis, what happens is that the endometrial tissue gets impacted in the uterine wall itself. So this is another condition which is very, very serious and very severe, in the sense that if not treated well, it can obviously impact the fertility and subsequently develop into very aggressive cancer as well. And as you rightly pointed out, the main thing that the scientists have been able to find out is the dominance of estrogen. So, a lot of estrogen in the body leads to low progesterone levels, and this can really make the situation very complex. So, we are here trying to deal with a situation where there is a lot of pain, there is probably heavy bleeding, we are struggling with trying to conceive. So this is a combination that is there, and it is difficult to treat only with one kind of method, because we have seen that what conventionally what the conventional treatments that are offered, they are something like hormonal treatments, or maybe some intrauterine devices to be used, or ablation therapy, etc. Now, all these kind of treatments may not be suitable for a large number of women, especially those who are trying to conceive. So we have to look at alternative treatments, and that is where homeopathy comes into play or into picture. Now, apart from whatever the causes that I have pointed out, we have seen that a lot of scientific research shows us that these conditions are also affected by the food that we eat. So there has been enough research to show that high gluten levels, or excessive gluten, excessive soya, excessive dairy products, etc., can sustain the inflammation, or can in fact feed this kind of a situation where the estrogen levels go on rising. So that is why, apart from the homeopathy, we are now looking at all the other alternative things where we can, give a sort of an holistic approach, or have a holistic approach where we consider not only managing the pain and the bleeding, etc., with homeopathic remedies, but also give certain other guidelines to patients, because we have found out that it is very, very effective when we work together. Now, when we are talking about homeopathy, I've also said in the past that homeopathy works on individualization. So we are trying to, take into account all the emotional aspects of the person as well. So now we know that whenever a person is stressed out, this also plays a very important role in our hormonal balance. So trying to understand why the person is stressed out, what is exactly happening in her life, how we can help her to address those issues. These are some of the things with which homeopathy, can really help into. Apart from that, we also have specific homeopathic remedies which act as anti-inflammatory, or which act as specific remedies for Hydrastis canadensis, for example, is one remedy which is known to have its properties which are antiviral, antibacterial, anti-inflammatory, and so many good properties it has. It can be very effectively used in these kind of cases. Or there is another remedy which can be really specifically used. It goes by the name of peonia. So this is known to lower the estrogen levels specifically. So with the help of these kind of remedies, and of course with the other remedies that are there, we have over 4,000 homeopathic remedies which we can use depending on what is indicated in that particular case. So to bring down the inflammation, to ease the pain, we can surely and effectively use homeopathic remedies.
Great,
Now,
doctor.
as
Sorry, go ahead. Go ahead.
No, so what I'm trying to convey to people is that we have to look at all the alternatives, because we've seen through experience that only looking at one method of treatment may not help. We have to couple a lot of things. Like I said, diet. Now, another scientific research tells us that vitamin B12 deficiency is one of the important causes why estrogen levels can go high. Okay. Or for example, we know that magnesium is a very, very important element which can relax your muscles. So we have to ensure that we are treating a person and trying to address all these issues also. We need to try and find out what is going wrong, where it is going wrong, and then take an integrated approach. That's what we do. And homeopathy is very, very effective in these kind of conditions, as I already told you. Yeah.
Great,
So,
Dr. Abhay. Thank you for that. So, Dr. Abhay, how do people, what are the tests involved to determine endometriosis? Besides scans, is there anything else besides the symptoms and observing the symptoms? What would you advise people if they are facing some of the symptoms that you have mentioned? What is their
Yes.
next step to get checked? How would you be able to check this out with what kind of reports, please? Yeah.
Yes. So basically, generally, what happens is that when a person comes for homeopathic treatment, we see that already she has gone through a lot of investigations, and we come across most of the cases where a diagnosis has been established. So the routine, the ultrasound scans, then the MRIs, and all these things are surely there to help us make a diagnosis. And in most of the cases, we also advise them to do a full panel hormonal test also to see what the hormonal levels are, etc. And all these investigations, and so these are the basic investigations that we would advise for anybody to who is suffering from severe pain, or who's having painful sexual intercourse, or who's having very heavy bleeding. The first thing is that we would ask them to, go to their gynecologist or come to us, and we advise them all these investigations and find out what is the basic reason behind these kind of symptoms.
Okay. All right. So, Dr. Abhay, in our experience, we've seen, because we're always keen on finding out what the possible root cause of this condition could be. So,
Yes.
we know today scientifically that sleep deprivation is connected with a hormonal imbalance that can
Yes.
cause the estrogen levels to shoot up and the progesterone to fall. We know a sedentary lifestyle as well. You already pointed out a poor diet, can cause a hormonal imbalance because of the amount of stress it creates. Consumption of too much of coffee and tea will obviously boost cortisol and adrenaline, resulting in, a shoot up in estrogen and lower progesterone. And then, of course, we know stress is a major, major factor. In fact, all of our endometriosis clients, whether they're endometrial cancers, all of them have a deeply rooted seat of stress in their systems. In your practice, what else do you see as the possible, weight gain is something else. We've noticed a lot of women when they start putting on a lot of weight in their abdominal area,
Right.
which is a sign of, excess estrogen being stored in their bodies. These are some of the indicators we see. What is it that you see in your practice amongst, patients who come to you with endometriosis? Any commonality or patterns that you have identified?
No, no, the main thing that we have really identified is, of course, the stress.
Mm-hmm.
Stress is something which is most commonly seen in these kind of patients. And sometimes, of course, there have been other kind of surgical interventions, etc., which they have gone through. So previous maybe sort of a PCOD, and then somebody tried to just remove that cyst or something of that sort. These kind of things also are commonly seen, or a previous C-section scar, which eventually has led to this. So these kind of things are seen quite often in practice.
Okay. We
But
recently had
as I,
go ahead. Go ahead. Sorry. Yeah.
no, sorry, continue.
Please go ahead, doctor. Yeah.
So essentially, what I said is that what we have realized over the past around 20 years that I've 25 years that I've been practicing is that we have to have an integrated approach, because we have seen specifically that the kind of cases that we see, if we put them on a specific protocol where we really ask them to manage their food and exercise patterns, especially even we try and add yoga to it, because there are wonderful yogasans which we can advise, which can, open up the pelvic floor, allow the drainage of trapped blood, etc. We also try and teach them the techniques of a sort of a fertility massage that they can do, or castor oil packs that they can use to relieve these adhesions. So all this in combination is really helping our clients very well. That has
Okay.
been my experience.
Oh, that's great. Great, Dr. Abhay. I want to touch upon a slightly, I wouldn't say it's a controversial topic as such, but we've noticed a huge commonality in, people who have got these, for the treatment of their periods, they get these marinas put into them and all of these
Yeah.
implants, which apparently help symptomatically. But we
Hmm.
have seen side effects of this. I can't really make a statement right now, but we've got a lot of patients, who have ended up with certain cancers. And in our diagnosis, I'm not saying it's caused it, but we
Yeah.
find a commonality of most of these women have gone through that process, rejected it very badly when it was put in them, but they continued to keep it because eventually it stopped the bleeding. Is there
Right.
any take on this? Scientifically, there are mixed reviews about all of these implants causing, again, fluctuations in estrogen that feeds ER positive breast cancers and all of these things. Any take on that? Any views of yours and your experience with this?
No, so as you said that scientifically also there are mixed reviews about all this, and essentially what we try to do many a times, what we are seeing is that women, of course, it's a very painful condition when they have
Yeah.
endometriosis or these kind of things, and they want to get relieved of the pain and the heavy bleeding, etc. That is why probably many a times they look at these IUDs, etc., as a quick fix,
Mm-hmm.
so that, and then eventually this is leading to ER positive cancers and things like that.
Yeah.
So if we are able to intervene this, and if we are able to treat them effectively with safer homeopathic medications, I'm sure that a lot of women would like to go and take that as an option, and that would really help them in long term. So we should look at managing the pain and managing bleeding with safer options for sure, and
Absolutely.
homeopathy has those kind of options available.
Yeah, we've seen that, Doctor. You've fortunately treated a lot of our patients who are completely off those IUDs today. And in fact,
Right.
yesterday, I think we got the good news that one of your patients in Singapore also conceived after
Yeah.
starting your homeopathic treatment and making changes in their lifestyle. So thank you for that. And thank you, Dr. Abhay, for helping us to understand endometriosis and the role of homeopathy in that. We're looking forward to more such sessions with you. So thank you. Thank you, Dr. Abhay. And thank you, everyone, for joining the session. The recorded session will be emailed to everyone who has registered, but unfortunately missed to join the session. Have a good evening, everyone. Bye,
Thank
Doctor.
you.